Happy Lunar New Year. Happy first day of Black History Month as well. I am so excited to be here at Daily Table with our partners in the nonprofit space and with our amazing district councilor, Tania Fernandes Anderson, to celebrate some big news that they have recently secured approvals to make life even easier to access nutritious, affordable food. So I'm going to pass it over to Michael and Rose from Daily Table to tell us what the news is.
Great. Thank you all for coming. We are so excited to have Mayor Wu and Councilor Fernandes Anderson here to announce the launch and our approval of Snap Online. We are the first independent grocer in the state of Massachusetts to be able to offer customers to purchase groceries for delivery using their EBT cards or SNAP benefits. It's an important step for us, particularly for our mission of making healthy food affordable to all, particularly in low communities that need the support. For the past 2 years, we've seen skyrocketing rates of food insecurity, and this is one additional way that we'll be able to increase access and equity to communities who need it most.
Good morning. We all say thank you to you, Mayor Wu, for coming. So we are so excited to launch this program, so to help people to afford more healthy food. So now they can order their food online and pay with their EBT card. So we are really excited for this launch, and we can't wait to have them ordering and help the community. Thank you.
Good morning, everyone. If you don't mind, I'd like to do an interpretation of this to the Cape Verdean community. Bom dia para todo mundo que está a ouvir cabo-verdianos. Gostinhos por usar cartão de EBT, de food stamps, ali na Daily Table. É programa, assim, eu sabe, nunca tem seguridade de comida na nossa comunidade. Então, no mês, tipo, não tem mais oportunidades para não usar EBT. Só nós podemos bem e também nós podemos ir online. Nós usa também mesmo cartão de food stamps. Nós está ordem online. Okay, so I think I'll leave the Spanish to Mayor Wu. I'm super excited and so happy to be able to have this program here. Daily Table, as we know, is an amazing program, and we'd like to do more of this. Hopefully we can expand, create more access, more ways to completely do away with food insecurities in our community. Extremely important. Maybe next we're collaborating with gyms and our medical providers, our mental health providers, and create this ecosystem of holistic life in our community. Thank you so much.
I'm so excited. I did a little shopping earlier. Rose was helping guide me as we filled one of the online orders that have already come in. I'm told that since the approvals were given, and again, this is a big deal because right now the approvals to use SNAP benefits for online purchases, making life that much easier, and just recognizing how hard it is for especially working parents, working families with kids to be balancing everything. That barrier has been taken down previously only for the very, very large players, the online Amazons and other players, Instacart. And so to have one of our own local nonprofits able to provide this service and continue growing throughout the city, bringing that access to every single resident is a wonderful, wonderful opportunity. We also know, we're proud that the city of Boston played a teeny tiny role here, and so I want to thank especially our Office of Food Access, Hayen and Magda and Elisa for really stepping up and making sure that we could help fill some of the gaps there and getting this program up and running to help subsidize the delivery fees for residents who are accessing this food. We also know that this is a moment during the pandemic where we need to be transitioning from just addressing the emergency, reactive, immediate needs around food access and hunger to really thinking about how we create a better food justice system overall. Supporting our small businesses, connecting local agriculture and food production to the opportunities to support our residents. And so I'm very grateful. We know that this is one of 11 locations where residents can use their double up SNAP bucks, and this is one of 3 locations of Daily Table so far. We're hoping for more, and very excited to make sure that we can all be celebrating just taking down a few more barriers for our hardworking families. Entonces, en español, estoy muy contenta para anunciar con los líderes en Daily Table los anuncios de ahora es más fácil de accesar las comidas, los alimentos, porque en este momento es posible para los residentes que usen SNAP y los beneficios de SNAP para comprar los alimentos en línea y recogerlos en su casa. Es un poco paso con los recursos de la ciudad de Boston, especialmente la oficina de acceso de alimentos. Y estoy muy agradecida a todos los miembros de la comunidad para cerrar esas brechas ahora. Okay, questions for anyone?
Can you talk a little bit about when you think of food delivery, you think of sort of luxury. Who are the people who are going to take advantage of this, and how were you able to manage to make this a free delivery?
Yep. So I'll just speak a little bit from the programmatic side, and I know the district councilor will have a lot to say as well. I am a mom with 2 kids. I'm a working mom. I have many a night where it just feels like you can't juggle everything, and to be able to have this option available for so many of our families who have been bearing the burdens of this pandemic, who already face such tight requirements and burdens of living in an even more expensive city, we need to make more options available. And so I know it's taken a while for the Daily Table team to secure these approvals from the federal government, and so we're really excited to make sure that we're highlighting this option here today. The city's office did provide a bit of support with grants to help subsidize the delivery part, because the requirements around SNAP are very strict, that it can only be used for the food itself and not for delivery, not for bags or anything like that, as I've learned. And so to be able to draw in other partners and show that this is here, it's accessible, and the city can help support it a little bit. Councilor?
Thank you so much for that question. The reason why it's such an important question is because I think that there are so many stereotypes to that, right? So people already have their presumptions about how or what is luxurious for low-income families. So imagine a family with, maybe 2 or 3 children and already a pre-existing some kind of medical condition in the middle of a pandemic, and then a snowstorm, a blizzard, and you have no car. Maybe you do, it's a hoopty and it doesn't work anymore, right? So then you have to get your kids to school, but one bus is late, and then the other kid might be sick. You go into the hospital. By the time you get home, you've had no time to provide. So you eventually, right, inevitably, we spend on fast foods, right? And so we have all of these pre-existing issues. On top of that, our stressors, there's no place anywhere for us to decompress, but then you can't provide healthy meal for your child, right? This allows an option for you at least to provide healthy access, right? So then it's not luxurious. Then it's a necessity. It's equitably planning, right? So I hope that folks can open up their minds to this program and that we can expand on it and be able to think of other, in the perspective of the low-income family, what the needs are as opposed to the opposite. Thank you.
What the feeling to be left out is for a group of people, for a vulnerable group of people, and the dignity it affords them when they can get in and be playing the same way everybody else in society is to address their needs.
Absolutely. I mean, I'll tell you a little short story, right? So I tell you guys like all the time, like I lived in Roxbury in Academy Homes. I was an immigrant, no green card, right? So I get to these projects and there's nobody around but me and my mom, and then I work enough, save money, bring my brother and sister over from Africa. We get here and there's no food, right? So the feeling of always being excluded and not having, my brother would come into the house to this day, he'll come and visit, and he'll say, "Hey, where's the tea and hot dog?" The joke is that the last thing in your hot dog is freeze-burned, in your fridge is freeze-burned hot dogs and a tea bag that always lasts in the cabinets, right? So with that, you know what I mean, you you know that you haven't been included because the programs and your society and you vicariously internalize all of this stuff. You feel like you're not worth it. My government doesn't care about me. My government doesn't include me. And so therefore you act as though this is a reality. And so we create this dual personality. You know, Baldwin talked a lot about it, right? In terms of code switching and how we perform in our society. So for us to be included for the first time, for us to have real conversations, is for me to be able to say, do I have the tools? Do I understand my needs? But not only that, do I have the courage to be able to say empirically that I know that I deserve to be included? So it's deeper than just saying, give me that, I need that, or whatever. It's to be able to change paradigms in a way that people automatically reserve their judgment and talk about this thing truthfully, honestly, and to be able to begin to apologize and accept what has happened to our people and how we've treated the people lowest in our society, socially and economically, of course. And so to me, it's a big deal. Every moment, every policy that comes out that I feel is equitable, I'm going to support my mayor and I'm going to be present. I'm going to be very vocal and very strong in that position. If it means that we're pushing forward to include all those who haven't been included, you're going to see me and we're going to continue to fight. And I appreciate you being here every single time so that we can create, you know, the buzz, so that we can spread out this information and make it accessible to people, to those who are not on TV today watching.
And go fight.
Today marks 2 years since the first COVID case was discovered here in Massachusetts, in Boston. Can you kind of reflect on that and where we are today?
It feels like yesterday in some ways, but it's also been an eternity. Today is the first day of Lunar New Year, and I remember now 2 years ago when we already started to see the impacts of the pandemic and of COVID-19 even before the virus was really circulating in the community in Boston. We saw the impact on businesses. We saw the fear and the sense of anxiety and isolation that was already starting. And so it's been a long, long 2 years. We have a lot of work to do. As the councilor was just saying, there are so many steps we need to take to continue bringing equity and to bring resources and to bring opportunity to our communities. And really, the issues over the last 2 years are not new, right? The virus is ever evolving, and we are always looking to stay on top of that and stay ahead of the curve. But it comes back to the same issues that for generations our city has needed to address: housing inequities and the racial wealth gap and access to fresh and nutritious, affordable food, access to transportation, the baselines that every one of us deserves, schools that we're proud of for our kids. And so we are taking big steps on all those fronts, and I'm proud to have community partners who are working just as quickly as the city is.
¿Busca expandir este programa si este tiene éxito en estas 3 locaciones?
Sí, espero que este es un paso primero en la oportunidad de crear el acceso a alimentos en línea para todos los residentes en Boston. Es un poco difícil porque la prueba y los permisos son del gobierno federal, entonces era un proceso muy largo para esta organización y comunitario, pero el ejemplo de Daily Table es un modelo para todos los esfuerzos sobre acceso a alimentos y nutrición.
Para la comunidad latina, porque hay bastantes en esta área, ¿qué impacto cree usted que busca tener ese impacto?
Sí. Do you understand anything on this? Sí.
Para la comunidad latina y también los caverdianos, todos los migrantes que están en esta área o que viven en Boston, este impacto va a ser tremendo porque imagínase que puede llevar comida a su casa y tener acceso de elementos que son saludables en tu casa, ¿verdad? Y sabemos cómo es difícil. Nosotros a veces trabajamos 2 trabajos o 3 hasta y que no tenemos acceso, ¿verdad? Entonces tener un servicio que podemos tener acceso y también que entiende que está incluyendo nuestras necesidades básicas humanas, ¿verdad? Esto es tremendo. Entonces creo que poco a poco tenemos que apoyar la familia a entenderse como hacer los órdenes, ¿verdad? A veces va a tener algún problema. Y mi oficina está abierta. Cualquier persona que necesita ayuda, por favor, llámame, que estoy aquí para ayudar.
Can I just add one thing to this? Como hablamos, el más importante visión es que el acceso a alimentos asequibles y nutrición para todas las familias no es un privilegio, pero una necesidad básica para todas las familias.
Sabemos que es muy difícil también para muchos, tal vez inmigrantes, otros que no hablan inglés. ¿Se podría ordenar de manera telefónica o únicamente por la aplicación?
Can they order by phone instead of online for delivery?
No, we have a mobile app, but we don't.
Okay.
Or is there any assistance in Spanish for those that might have issues doing it online?
We were working on getting. We were working on getting our translations live and all the how-to documents for either online or via the mobile app.
And we'll be a partner for that. And one thing that's important to note here is los alimentos no solamente acceso a alimentos básicos, pero hay un foco especialmente en acceso cultural y la conexión a la cultura y tradición entre los alimentos también.
Español sobre los 2 años de la pandemia.
Okay. Sí. Estoy muy emocionante sobre este aniversario de la pandemia y también en el primer día del 9 año lunar, porque estaba un viaje estaba muy largo para todos los residentes. Los barreras que abren, la lucha sobre acceso a viviendas asequibles, transporte público y alimentos asequibles también, es muy difícil durante la pandemia. Entonces es un momento muy urgente para el gobierno municipal y de todos los niveles de tomar cada paso posible de cerrar esas brechas y empoderar nuestros residentes.
The deadline to respond to the lawsuit that public safety needs to draw this later this week. Is there a timeline for the city to do that? Plan on?
I believe our response will be filed later today. It should be very shortly.
Mayor, you talked about how there's still work to be done 2 years afterwards, but there are a lot of places that are saying, a lot of towns and cities that are saying, we're a lot better off. We have vaccines. People are not getting as sick. The numbers of hospitalizations are going down. So do you have any plans to roll back mask mandates or vaccine mandates in the near future?
We're in constant communication and with all of our hospital partners to very carefully watch those hospitalization rates. And our Boston Public Health Commission has been working on metrics as we understand community positivity and where we may be either plateauing or coming down quickly. And so COVID will be around for a while. Even after we are through this surge, we know it is likely that next fall, next winter, there likely will be another surge. But in the meantime, as we're tracking these numbers, these protections are not permanent. They are to make sure that we are safe in the most urgent moments, and we will continue to take steps to balance that guarantee of safety through public health policies that are responsive and clear, as well as the need to provide support to our small businesses. Very recently, our city has made it, well, hopefully we're working with the City Council to allocate federal funds that would go to support small businesses, and the applications would open shortly so that small businesses that have been struggling so much during the pandemic have one more avenue through municipal support.
So there's no actual date that you're kind of targeting at the end of the month, the end of the year?
No date as of yet.
Could you go into a little more what those metrics are that you are looking at in terms of figuring out the end of this disaster?
As we think about the need and the urgency for strong protections from the pandemic, there are a couple metrics that help us understand where we are. Of course, there's community positivity, and we peaked at a little over 32%. We're now down to, I believe, somewhere around 18%, although I'd have to check with Dr. Ojikutu to be sure. And so we've been seeing that come down in recent weeks. We're also looking at hospitalization rates, and we're looking at vaccination rates across the entire population.
And are the thresholds that you're looking at similar to what, like, the previous administration had those, like 5% positivity?
So it's, the virus keeps changing, and the 5% threshold was around Delta, where it was a more dangerous illness if you are sick with Delta, but less contagious. And so when Omicron was up to 10 times more contagious, but tended to be on average more mild, the threat, we never imagined under Delta that we would ever be talking about 30% or above. And so we're trying to adjust based on current situations and also anticipate the continued variants that may come. Great.
Any thoughts on Brady retirement?
Hi, how are you?
My name is Lashina Butler. I've been calling y'all about that racial stuff. You know this place is not desegregated. You do know that, right? But all you see is white people. Shit's not desegregated. They put me in a mental hospital for 40 days because I've been the one starting the race talk, and y'all been taking that from me. All right, they also trying to take my car. They trying to take
One at a time. One at a time.
yeah. So all I'm saying, it ain't no such thing as what's going on. Y'all already know what's going on. The racism is what's going on. And you know what? Kim Jamie, I seen her down there. I didn't vote for her. I didn't even vote for you because I don't believe y'all have the guts. You understand me? Y'all talk about Martin Luther King, but did you see some of his quotes? Let me show you what his quotes say.
What's your...
I'm going to read to you what his quotes say. He have a whole quote.
Okay. I'm going to talk with our constituents here, but thank you, everyone. I'll follow up on Brady after.
Martin Luther King said that history